Thank you for staying with us on Channels Television. Welcome to Health Matters. I am Yomi Otaigbe. The complex interplay of factors that lead individuals down a path of dependency on drug and illicit substances takes our attention today on the program. We're focusing on the ripple impact of drug and substance abuse on individuals, the society, and how to curb this silent yet disturbing trend. But before then, let's tell you that the resident doctors in federal hospitals across the country have complied with the 5-day warning strike declared by the National Association of Resident Doctors, leaving patients unattended and disrupting medical services. Channels Television's visits to federal health facilities in Lagos, Bauchi, Kano, and other states reveal empty patient waiting rooms and stranded patients at the clinics and wards. Although nurses and consultant doctors are rendering skeletal services, the situation leaves patients and their family members in despair. The strike action followed the expiration of a 24-hour ultimatum issued by the NARD to the federal government after its earlier 10-day deadline lapsed on September 10. The association's demands include the release of the 2025 Medical Residency Training Fund, the payment of 5 months' arrears from the revised Consolidated Medical Salary Structure, settlement of outstanding specialist and hazard allowances, and improved welfare provisions. Certainly, this is no good news for many Nigerians, and we are hoping that the industrial dispute between the resident doctors and the federal government will be resolved quickly in the interest of the patients and those seeking medical services in federal government hospitals. We have more for you on our news segment.
Owing to the recent reports of Ebola virus disease outbreak reported in the Democratic Republic of Congo, the Nigeria Center for Disease Control and Prevention, NCDC, has issued a nationwide advisory on the need to stay calm and vigilant. A press statement by the Director General of the NCDC, Dr. Jide Idris, indicates that there is currently no case of Ebola virus disease in Nigeria and that the NCDC is actively monitoring the situation with stronger measures put in place to protect Nigerians. To be safe, NCDC advises that you wash your hands regularly with soap, water, or use a hand sanitizer. Avoid contact with anyone showing fever, vomiting, or unexplained bleeding. Do not touch body fluids of sick persons. Avoid raw or uncooked bushmeat. If you travel to or from affected countries, watch your health closely and seek help if symptoms appear. The NCDC reminds everyone of the common signs and symptoms of Ebola, which include sudden onset of fever, intense weakness, muscle pain, headache, and sore throat, which are usually experienced at the beginning of the disease. Other symptoms that follow are vomiting and diarrhea, and yellowness of the eyes. If you or someone with a travel history to any country with Ebola cases experiences symptoms of Ebola virus disease enumerated above, call the number 6232 or the nearest health facility immediately for guidance. Meanwhile, the Adamawa State government has confirmed that 6 persons have lost their lives following an outbreak of Buruli ulcer in 4 communities in Malabu district of Fufore local government area of Adamawa State. Speaking to journalists shortly after the State Executive Council meeting at the Government House in Yola, the State Commissioner for Health and Human Services, Mr. Felix Tangwami, reveals that failure of affected persons in assessing health facilities due to traditional beliefs resulted in the number of deaths so far recorded in the affected communities. Mr. Tangwami says samples from affected persons have been collected and dispatched to the National Reference Laboratory for further investigations on the disease, and the communities are under close watch to prevent further spread.
We have sent our staff to that place to reassess the problem. The Buruli ulcer that is devastating the Malabu community. It came to limelight when the conditions degenerated and the communities felt the need to assess hospitals. before then, they had this idea that such problems should not be taken to the hospital, because they have the belief that if they take the problem to the hospital, automatically somebody will die.
The Association of Radiation and Clinical Oncologists of Nigeria, ARCON, has identified major challenges fueling the spread of cancer in the country. At a press conference in Port Harcourt, the professional body highlights lifestyle changes, environmental hazards, limited manpower, late diagnosis, and high treatment costs as the driving forces behind the rise in cancer cases across Nigeria. The body notes that cancer remains a silent epidemic with nearly 125,000 new diagnoses and over 78,000 deaths annually.
Policymakers need to be able to provide dedicated funding to support cancer patients. We currently have some funding to support the top 3, but what if the next person's cancer doesn't fall in the top 3?
Welcome back. According to the United Nations Office on Drugs and Crime, Nigeria has one of the highest rates of drug abuse in Africa, with an estimated 14.3 million people aged 15 to 64 using psychoactive substances. How do we tackle this silent menace? A clinician who is also an addiction psychiatry specialist at the Federal Neuropsychiatric Hospital, Yaba, Lagos, Dr. Olajumoke Koyejo, joins me now in the studio. Thank you so much for your time today.
Thank you very much. Good afternoon.
Okay, so let's explore these complexities of drug and substance abuse. For context, what would you say, how would you classify drug and substance abuse?
Well, I would even say drug and substance abuse, or say addiction, because there's behavioral and there's substance use problem. And if we just talk about substance use, then we're not doing justice to the problem at hand. It's a very big problem, and in my own hospital, Federal Neuropsychiatric Hospital, Yaba, 2/3 of patients that present in the hospital at one time or the other have substance use problems. So it's a huge problem out there. And Lagos State has 33% prevalence. That means out of 10 random persons, 3 has substance use problem. 3, so these are problems that we really have to face. And it's everywhere, it cuts across. It's not just about the poor, the rich, the working, the unemployed, and everybody. It's very close, it's around us. It has come to stay, and there's need for us to actually see it as a problem and work to prevent it, to reduce this prevalence. It's so high.
It's frightening for me if you say it has come to stay, because we really need to fight it.
Definitely.
So what are those things that trigger, or those factors that make people abuse drugs or substances, and perhaps some of those substances that you can mention?
Okay, different things. There are genetic factors. Sometimes people are just prone to use, and it depends on availability. Yeah, people are, to have a disorder though, of course, if it is not available or accessible, they will never get there. There are so many things in our genetic loading that make us prone to such things. But there are mostly environmental factors that make people use. Let's talk about the immediate family, the immediate environment, the family, the school, and even religious organizations. Availability, accessibility, everywhere. So if it's available, if it's accessible as a young person, there are no policies, no laws, nobody enforcing, telling me not to use, people would use. So it's everywhere. In fact, it's a sign of maturity. It's like a passage right now. It's until you start using for a guy that you are matured. So
So that would be peer pressure.
Of course, environmental factors. Let's say environmental factors. Families are not up to the task anymore. Everybody is just, we all want to have that, to be that richest person around. And so we are all lacking. The immediate environment, that's the micro environment of an individual, are the first things that has to be tackled to help in prevention.
So that means the environment the person finds himself or
yes,
herself.
Yes.
Maybe you have users around that area.
Definitely.
Okay.
So when I said I've talked about availability and accessibility, it's available everywhere. It's cheap. And you know, the way once something is
sorry, if you say it's available everywhere,
yeah,
I haven't seen, aside from maybe you see where someone is selling cigarettes, I have not seen. So is it a question of people know where to get it?
It's because you have not asked for it. If you go out here, it's because you have not asked for it. It's available, it's accessible. It's because you have not asked for it. If you ask for it, they'll just give you. In fact, you'll be shocked the speed at which it will be made available. And it's cheap. So the immediate environment, which includes the family, the school, the workplace, these are things that we really have to look into. So if it's say people are using, it's because it's available, it's accessible. So if it wasn't available, if it wasn't accessible, if the family is doing the job, if the school is doing the job, then people won't, the prevalence won't be this high. We must work for it.
So doing the job means what?
If the family, I tell people that some of my patients will tell you that they started using from their parents' bar. Yeah. So having a bar at home, people feel it's a sign of affluence. It's a status thing. But
so that would be for alcohol, I guess.
Yeah, of course, that would be for alcohol. And alcohol is a gateway drug. So alcohol is a gateway to other substances. So when they start with that alcohol, yeah, and it opens the gate for other things. Then parents, when you smoke, when you use in front of your children, you know, you're modeling. And your child will probably do much more than you are doing. The child will probably do much more than you're doing. So the child will just go ahead and use and would do more. So these are the type of things we're talking about. Adults can do anything they like, but they should consider children. They should consider people looking up to them. It's do as I do, not do as I say. Your children, you might tell them all the best things from your mouth, but what are you doing, madam? What are you doing? So modeling is extremely important. I've talked about the environment, availability, accessibility. Then school. School has, of course, peer influence. Then school is a very important aspect of prevention, because there's this study that I saw. In fact, there's this curriculum, school prevention curriculum, the school environment. What is the school preaching? Teaching rather? What are you know, the prevention? There are soft skills that children that you need to teach them. You can imagine teaching your children self-esteem building in school, communication skills, socialization skills, coping skills. These are basic things. Age-graded information in school will really help our children across the board and helps in the prevention of substance use and other addiction. So I don't even want us to just say substance use. Let's say addiction. Gambling.
Addiction to what?
Gambling, behavioral addiction and substance addiction.
So break down the behavioral addiction.
Gambling is everywhere. It's a big problem. And we treat, and you see patients presenting in Yaba Psychiatric for gambling disorders. They've borrowed over 5 million naira. They have, you know, all these quick loans. They just keep borrowing to gamble. And it becomes a problem. In fact, they accept to come for treatment. So there are several things we really have to look into, not just about substance now. It's a monster in here that we really have to deal with.
Okay, so that's about, maybe we'll put it for young people. What about older people? What is it that will make, so the statistics I talked about earlier was between 15 and 64. Yeah. What will make a 50-year-old man, a 60-year-old man go into addiction?
He started it when he was younger, so it's just growing up into it. It's not as if he just picked it up. Of course, after retirement, there's this risk of substance use. They're at home and most likely they have the money. They just keep drinking and moving around from one party to the other, all expense paid and things like that, trips. But they've always had it when they were younger. And so they are growing up and they are growing with it. It's not as if they picked that habit at age 50. Most people won't pick up that habit at age 50. Pick it up in their teen.
But that's not to rule out the fact that some people may start at that age.
At age 50?
Maybe because of life issues.
Well, maybe really. Of course, some would. Of course, there's no never in medicine. Of course, some would start at that age. Life issues, but these are not common cases we would see. And if you start at age 50, the prognosis will be very good. Because there's probably a causative, there's something causing it at that level. And when you remove the cause, the patient will probably do well. The prognosis will be very good because it would be accomplished, there will be career, there will be family, the social support would be there. So someone started at age 50, well, you probably be able to treat such persons easily, and the brain is fully developed. But in a young person, age 9, age 12, age 13, people below age 25, the prognosis won't be good because they probably not be able to go through school. So they don't have any skill. They are probably, it has already affected their brain. So even neuroadaptivity would have occurred. So the brain is affected, the functionality is affected, relationship-wise they are affected.
Yeah. Okay. So let's take a quick break. When we come back, we'll be talking more about some of those signs we need to look out for, maybe in young people, so that parents, guardians can take action. Do stay with us on Health Matters. You're watching Health Matters on Channels Television, and we're talking about drug and substance abuse. And the doctor here has added addiction to it.
Addiction.
Before we went on that break, I said we're going to talk about some of those signs, symptoms of someone who may be into drug or substance abuse.
Yeah, thank you very much. You know, for a teenager, the first thing you would see is drop in grades in school. Unexplainable drop in grades, poor personal hygiene, and parents are becoming secretive. There are some lies that are not, things that are not adding up. I'm not saying they are equal to, but these are the first things that will start happening, and they start becoming irritable, and they just become unduly secretive. Because you won't, most likely, you will not find the substance with that person initially. But when you start seeing such things, a child that would iron his clothes 10 times before, you know, all the gators being there, now does not care about the looks. There might be something happening. You start being unduly irritable, bloodshot eyes, then there's something happening. Losing appetite, losing interest in things that are in school, and productive things, then there might be something cooking. So these are the first set of things that you'll be seeing. And in an adult, well, the 50-year-old you talked about, the relationship, the wife, the spouse, and the family and the broader social context. Something the wife can't explain, the spouse can't explain what is happening. Does someone becoming irritable, is not being responsible financially anymore at home? These are things that an adult might present with. And, you know, he starts going late to work, his work is not as important to him as it was. Oh, then what is happening to this old man now, to this old man? So these are the basic things. Of course, if you look closely on that teenager or that undergraduate, you may now start finding lighter. Then you might start, if you look closely again, then you might actually catch the person with psychoactive substances. So then, like I said, addiction, behavioral addiction. Don't let us talk about substance alone, because these are things that it's a bad addiction, and of course we are treating it. And the one that is not that we are not put a name to, the screen addiction too. Just like to touch the phone, screen, and the rest like that. These are problems. Of course, it's not official yet in the ICD-10 or 11, but it's something that people are beginning to look into. Because that's the next problem addiction professionals will be treating, screen addiction, you know. So these are the type of things.
So I hear you say he sometimes, or most of the time. But I want to tell you about a video I saw online of young girls.
Definitely.
Who, I don't know what kind of drugs they may be, but they were all like zombies. So it's not just about the male child or the man, but women too. Definitely. How much of this do you see at your center here in Lagos?
The male ward is definitely bigger, and the prevalence is higher in males. But females too are catching up. But the problem with females is that there's so much stigma even bringing them to care. Their wards are smaller, so they're not specialized. Care is not actually set. It's not done like putting the female child into context. So the prevalence is lower in females, but like I said earlier, they are catching up.
They shouldn't catch up. We don't want them to catch up, but we have a caller.
Yeah.
Okay. I think the person will call back. Okay, so let's talk about the impact, because sometimes if you don't know the impact of your action or inaction, you may not think so deeply about it. Let's talk about the impact, and then we talk about, the support, medical, and that they can get.
Well, let me just tell you that the impact could be social, could be medical, could even have legal implication or career-wise. Socially, let's put, of course, relationship at home. You don't know how much children value their immediate family, and you ask them, said, I value these people so much. They lose that trust at home, and it's a big deal for them. And socially, the adults too, spouses, they lose their work. Medical problems, these substances affect, you see, all the body organs. You see people having their liver enzymes reaching the sky and the rest like that. Of course, psychosis. And when you lose your brain, you've lost all. Then career-wise, they lose their job, they are dropouts in school, they can't complete their school. And the one that even hates most is the fact that schools will now help them, will now worsen the situation by expelling them. You can't do that. If the child is still coping, why not let us work together to help this child? Why will a school expel a child because they found substance? You must treat the child. If the guy is sick, then you treat, not expel. And I'm talking to all those universities that expel them. It is wrong, ethically wrong, socially wrong, morally wrong. You can't expel them. You help them because the prognosis becomes worse. And they will tell you that they are a lion in the midst of sheep. If your child is not matured enough, don't let the child go to university. Please, let's move on. So, and other medical problems that could happen, of course, legal problems, they're always getting into trouble. Crime and drug is 5 and 6, very, these are complications that would happen. Accidents, of course, they are prone to accidents. The complications are just varied across board. And they are really enormous. And you talk about the support system. I would even say we should even do prevention. And let me start with those universities. And am I allowed to mention school names?
Don't mention school names.
But there's this school that is doing very well. And they have a rehab in the school now. So the reason why you have built an health center in the school is the same reason, because you feel people will fall sick. It's the same reason you should have a rehab in the school, so that the child, as he's receiving treatment, can go to school. And I want to beg all the universities to actually told this line. There's a university now in Nigeria that had a rehab. So as you are being caught, they'll take you there and you can still go back to school. And of course, it will help them to be able to get their certificates and be more productive persons afterwards. But in primary schools, prevention, the Ministry of Education has a whole lot to do to help these children. It is not just about what is maths, what is English, what is physics anymore. We have to teach them soft skills that will help them across board. And these soft skills will even make the education more meaningful to them. I keep saying that there's a curriculum that we have in Yaba, and of course it's an international curriculum that will help schools that's maybe in their civic education. You can imagine teaching your primary 5-year-old daughter coping skills, stress management, self-esteem building, socialization skills. you can imagine how confident she will be.
That stress management you mentioned is very key, because sometimes some people reach out for things that won't help them at the long run, but they feel that they can find solace in taking such things.
So they won't go through, they won't be looking for maladaptive ways of going through stress. And I want to tell people that stress is part of life. Your ability to cope with the day-to-day stress makes you an adult. You're not just that calendar age. Your age is, you are meant to have a mental age that equates to your calendar age. And you can only build your mental muscles by solving challenges of life. So to all those people that want to escape those life challenges through use of drugs, then you won't be that mental age you are meant to be.
Okay, let's see. OJ from Badagry is here with us. Hello, OJ.
Thank you.
Quickly, please.
Can you hear me?
Yes, we can. Go ahead, please.
I want her to actually, tell us how do you identify a particular substance or drugs that an individual is addicted to. Then, too, she should be able to explain to us very well about what is Queen's addiction. She talked about it briefly, but she jumped it. So, please.
Okay, I didn't quite get what she said. I think it's saying something about addiction.
Yeah.
She talked about how do we know the exact thing the child is using.
Yeah,
of course, the child could tell you. You could ask, you could see it. Then there are blood tests, urine toxicology, that once you just do it, it will tell you all the substances the child knows he or she is using, or the person knows he or she. And those other ones it does not know. Because the dealer sometimes lace those things with some other things they don't even know about. Yeah. So urine toxicology will just reveal all those things to us.
Okay, yeah. I think we'll still have to talk about this some other time, because we're really out of time right now. But if there's anything you want to tell people concerning your center, if there's any case, where can they come?
Of course, Federal Psychiatric Hospital Yaba is a very good place, urine toxicology, at least even to know what substance the child is using. And
to get help for anyone who is under drug
or any form of addiction or behavioral
Thank you so much for coming today. We've been having a chat with a clinician who is also an addiction psychiatric specialist at the Federal Neuropsychiatric Hospital, Dr. Olajumoke Koyejo. Thank you for your time today.
Thank you very much.
And that's it on Health Matters for today. Thank you so much for watching. I'm Yomi Otaigbe.